another AutoBrush live stream. Today is a wonderful Ask a Dentist day with our wonderful dentist, Dr. Gibbs, also known as Dr. Yonan. God, I wrote a reminder to myself on how to say your name. I instantly messed it up. The first words out of my mouth. So sorry. But wonderful. We're super happy to have him today. Dr. Gibbs has been helping us at AutoBrush behind the scenes quite a lot with making sure our product just gets better and better with time. So we really like him, big friend of the family. So while we wait for everyone to hop in, how's your week been, Dr. Gibbs?
It's been very busy.
Feel that.
We have school starting now for a lot of the kiddos, so the parents are looking to get the kids in ASAP, get their dental work done. That way they don't have to take time off of school, which I completely agree with and understand. So we've just been very busy, but it's a good thing. We're getting a lot of people helped.
That's awesome.
How's your week going?
It's been busy too. I think it's just the August rush, like trying to get things in before the end of summer, preparing for the busier holiday season that comes right after school starts. So it's been a month.
Yeah, and once that time comes, it's like it just keeps going and going and going, and it's like it's gone in the blink of an eye. Next thing you know, it's like Happy New Year, and it's 2023, and you're like, oh gosh, okay, Q1 back again.
Yeah, please don't say 2023. It's way too early for that, and my brain can't handle it.
I know.
All right. Well, everybody, welcome to the stream. Let's just start with a quick introduction of who Dr. Gibbs is. So his real name, if you want to call it that, is Dr. Yonan, and he completed his undergraduate studies at CSU Fresno and then went on to A.T. Still University in Arizona, where he earned his DMD and his master's in public health. So Dr. Yonan combined his passion for giving back to those in need and his passion for entertainment to form a 501c nonprofit organization called Entertainment Healers. And Chris joined the chat, and I just see Gibbs everywhere, and that's all I can focus on. So hi, Chris.
Yes, blowing up the comment section.
He is the comment section. So as part of his 501c Entertainment Healers, he goes by the alias Dr. Gibbs. And with Dr. Gibbs, he creates dental educational videos using popular songs and changing the lyrics to provide oral health information. Dr. Yonan has a goal to make health a popular thing, and as the saying goes, health is wealth.
Definitely.
So we really appreciate you being here. And if you want to see more from Dr. Gibbs, we'll link his YouTube channel and his Instagram right below, and we'll pin it. So you can always go and check out his amazing work.
Thank you.
And his nonprofit. Want to make sure that that link gets in there.
Awesome. I appreciate that.
Always. Absolutely. So to kick it off, I just want to also say before we really do kick it off, if anyone has any questions at any point of the live, feel free to drop it in the chat. While we do have questions and things we want to cover today, it's always nice to go along and answer questions as we see it and spread the word about how health is wealth. So jumping into some interview questions and all that jazz, what would you say a typical brushing regime consists of? How can we make sure that we are brushing our teeth in the best possible way to take care of our oral health?
Yeah, definitely. So I would say most people have the order of oral hygiene a little bit backwards. They will brush, and then they'll floss, and then they'll rinse, and then they go to sleep. That might be okay, but there's a better method, a better way to do it. I always recommend flossing first. That's the number one thing I always recommend doing. Floss first, then you rinse your mouth out. That way you can flush out all that food that you just dislodged with the floss. You spit it out in the sink. You can see all that nasty stuff that came out of there. The last thing you do is you brush your teeth for 2 minutes, or we're using the AutoBrush, 30 seconds, 45 seconds, you spoiled. And then after you brush, you spit out the excess toothpaste, and then you just leave the rest of it on there. Don't rinse your mouth out with water, because then you're washing away all the goodies that are included with your toothpaste that are meant to help remineralize and keep your teeth nice and healthy and strong. After flossing, rinsing, brushing, Don't eat or drink anything besides just water, because if you do, then your teeth are dirty again, and guess what? You got to floss and brush all over again.
Interesting. I've heard of flossing first before, and I never tried it, even though flossing after I brush, like your gums feel like exposed almost if you're not flossing regularly, like with how you like dig in there. That makes a lot of sense.
Yeah, when you floss, you dislodge the food that's stuck in there, which allows the bristles from the toothbrush to be able to go through in between your teeth and clean the area in between your teeth a little bit better. Versus if you had food in there and you were to brush before you flossed, then the bristles may be blocked by the food that's stuck there and not able to access that area.
That's genuinely fascinating. And now I have to go like reevaluate my life. Thankfully, it's not a big change to reevaluate my life in, but I have to reconsider my routine. All right. Yeah, no, sorry. Sort of mentally plan out how I need to like change the order of like where I keep my mouthwash and all that jazz. Ooh,
Yeah,
I
it'll
love
be
good.
it'll be a good adjustment, a good change. Every time I
Yeah,
tell that to patients, they're just like, "Really? Wow, I've been doing this wrong my whole life." And I was like, "Well, I mean, you're doing it, which is good. There's a better way to do it. Here's how to do it."
I love that. I love thinking of better ways and like optimizing the small things in life to get that little bit of extra health benefit.
Definitely.
It's a small change. Like if you're already doing it, better is better.
Small
And
modifications.
yeah. So speaking of like those slight small modifications that can add up to like big like health benefits. Um, I know a lot of people are concerned with how white and bright their smile is. Do you have any recommendations on small things people could do to help make their teeth lighter?
Number one thing, go see your dentist. Number two thing, take care of your cavities before considering whitening. I always get a lot of people that come into the dental clinic, they sit in my chair and they ask me about whitening because they're more concerned about the appearance of their teeth more so than the health of their teeth. And it doesn't fix the issue. You can have nice, beautiful, white, clean, even straight teeth after braces, and they could be rotting out. And even though you don't see it, visually, I can see it. I can see it on the X-rays. I can explain it to you, show it to you, and the longer you wait, the worse the teeth get. Now, let's go away from the negative stuff. Aside from that, I would definitely say rinsing your mouth out with water after having staining foods, like anything with like certain spices like curry, or if you're drinking juices like pomegranate juice, things along that nature, red wine. Throw some water in there, swish it around, spit it out or swallow it, whatever you like. And the more you maintain your oral hygiene, the better. Now, there are sometimes stains that'll come in and they just won't go away. Even though you're rinsing with water and doing all of that, there's several different products out there for whitening, from toothpaste to gels to in-office treatment to strips, all kinds of different things. The first step should be seeing your dentist, because your dentist is going to give you the option to tell you what options might be best for you for whitening, what might be more effective versus you spending all this time and money trying different products out that may not work or that may cause harm to your teeth or your gums.
Yeah, I've noticed a lot of like just reading some comments and feedback on like different reviews from different products. A lot of people talk about that sensitivity or overusing it to the point where it starts to wear down like the enamel and the parts of your teeth that you really don't want to wear down.
Definitely don't, because once it's gone, it's gone.
Oh yeah. So with the different things around like wearing down enamel, things that once it's gone, that mentality. There's a lot of common dental conditions that I think go unchecked or like that people don't often think about in their day-to-day life. What are some common dental conditions and things to look out for that people should be aware of?
I would say bruxism or grinding is a huge thing. I tend to do it when I lift weights or if I'm playing basketball or something like that. I'll grind my teeth really, really tight when I'm doing something. And, I don't realize it, but some people do it throughout the day. And over time, you start to cause wear on the top portions of your teeth. That can wear away your enamel, and that can make your tooth more vulnerable to fractures. You can actually cause fractures of your teeth. I've seen 4 patients this week already with fractured off portions of teeth because they're grinding too much. And so for that, I would definitely recommend a night guard. You can get one over the counter, or you can get one made at a dental office. But that's one thing. The other thing that I would say is people seem to not really think flossing is important. And I brush my teeth, but I floss maybe once a week. That's not going to work. I always say brushing and flossing are equally as important. And I do have a saying, it's very graphic, but I tell it to patients and it's like stuck in their mind. I always tell them this: brushing but not flossing is the same as wiping your butt cheek but not the crack. It's not clean. You got to do both.
Oh, I remember that one. That one, like you're saying for that, stuck in my brain. I think I read it in
Oh,
a blog you wrote for on our website, and it stuck with me.
yeah.
It might be
Stay the hell
graphic.
away.
It's graphic, but it's sweet.
Yeah, you definitely need to have that graphic memory. So next time you're brushing, you're like, oh, I didn't floss. Ooh, I got that image in my mind. Let me go ahead and floss.
Oh yeah, that's
Yeah.
exactly what happened with me. Chris just sent a question in. He said it's been about a year since you released a song. Do you have anything coming up?
I've been so busy with a lot of stuff outside of the clinic that I haven't been on social media much to do things. But I have so many things saved on my phone, like song covers that I want to do. So stay tuned. There might be something. There might be something new coming up here. I might
Hmm.
throw in Chris in there and do a little couple of lines here and there.
Oh, I would love that. I would probably pay you money to make Chris do that because Chris
Oh
is
yeah,
like such a big personality, but also super shy, and I would kill for it. The
yeah.
people need it, but
The
specifically, I
people
need
need
that
it. Yes,
collab.
the people
But
need it.
yeah, hopefully once the back to school season's over, like you can have that mental break to,
Yeah, yeah,
do some
definitely.
projects.
Definitely. I mean, it's a passion that I have. I really enjoy doing it, but there are so many other things that are dragging my attention. Like there's a program that I'm developing now for my local community that helps connect high school students and college students with information about dentistry. So those people who are interested in getting into dentistry, I have like videos, I have meetings that I set up with them to kind of introduce them into the field of dentistry, whether they want to be a dental assistant, a hygienist, a dentist, and just answer questions because I do live in a rural community. And going back and helping that community understand what dentistry is and getting more people involved is always important for me. So I've been heavily involved in that, but I will definitely get some more videos out soon because that I really enjoy doing those too.
Yeah, that sounds fantastic. I didn't know that about like your outreach. That's so interesting, genuinely to me. I think
I do a lot of things, sometimes too many things, because I even struggle to grow my hair out if you didn't notice.
but like even just like when you have those kind of questions around like if you have a passion in life and you don't know what the next steps are, having a resource like what you're providing, that's very impressive and valuable. I thank you for on
Yeah,
behalf of the community. I think it's fantastic.
thanks.
So you did ask before when we were talking about some dental conditions to be aware of, mention grinding your teeth and as being one of the main things to be on the lookout for and to like check yourself on. Do you have any tips on how to stop grinding your teeth?
There is my favorite gum is called Icebreakers. Ironically, it's called Icebreakers. It has its number one ingredient is xylitol, and I always recommend patients chew this gum throughout the day because it forces their jaw to kind of keep moving, and they're chewing on this gum versus being close together. They have something physical inside their mouth. They're just like, oh, what is this? I have to keep my mouth going. So the gum is almost like a stimulation in the mind. It tells you keep chewing, stop clenching. I also recommend that gum for patients who have dry mouth because as long as there's that gum inside the mouth, the mind thinks that there's food in there and it'll start to produce more saliva, helping more natural saliva flow in the mouth. So I recommend that for dry mouth patients as well.
Very interesting. I just keep thinking about it because I just happen to also have like that like be on the lookout for bruxism from my like dental hygienist. So that's very topical, and I'm glad I'm getting dental health today. I don't know anyone else in the audience. Drop a comment if like you're finding this information helpful in your own life. But I've got like a new brushing routine. I have to go buy some gum. Like I'm having fun here. Um, so speaking of like food and like tricking your mind into eating, when it comes to actually eating, what does your diet matter like with your oral health?
Yeah, so I always tell patients, I'm the type of dentist that'll never tell a patient to stop drinking soda and to stop eating chocolate because I do both of those things and I'd be a hypocrite if I told them to stop doing them. You just have to do them in moderation. That's where diet really comes into play here with your teeth is you have to think of like acids and bases. That's really the chemistry behind what's going on in your mouth. Everybody's mouth has a whole bunch of different bacteria in there. However, the environment in the mouth is what actually dictates whether you're going to have a cavity or not. The more acidic, the more cavities you'll have because that's the environment that bacteria likes, and it uses that acidic environment to basically break down the enamel and causes holes in your teeth, which basically is a cavity. And so when it comes to eating chocolates or sweets or drinking sodas or juices, things along that nature, we have this saying, sip all day, get decay. So you don't want to sip with it all day. What you want to do is drink it during a setting or have that piece of candy during dinner, lunch, whatever it is. If you're sipping on the soda for several hours throughout the day, what you're doing is you're basically forcing your pH in your mouth to stay in an acidic environment, making the bacteria more active, causing more acid in the mouth, which breaks down the teeth. Your saliva naturally has a basic component to it. It's very basic. And so what it does is it neutralizes the acids in the mouth. However, if you're drinking more soda than you produce saliva, there's an imbalance. Now there's more acid than there is base, so you can't ever get that neutral zone. And so having a frequency control is really, really important. So don't snack all day and don't sip on sugary drinks all day. You can definitely have them, just in moderation.
Honestly, like again, like I keep saying that I just feel like you're talking to me specifically, but holy cow, does that make a lot of sense
It
too?
applies to a lot of people. A lot of people are like, I'm brushing, I'm flossing, I'm doing all these things, but I'm still getting cavities. Well, that's because, especially with kids, especially during the summer, we got Mountain Dew, Doritos, and video games. That's the trifecta right there. In dentistry, we actually have something called Mountain Dew mouth. Google it. It looks exactly like meth mouth. It's really nasty. The teeth are just bombed out, but all the sugar that's in Mountain Dew in combination with the carbs from eating potato chips and playing video games for like 5, 6, 7, 8, 10 hours a day is just very, very bad for teeth. And so with kids, I always educate them and I tell them, hey, get some water with you, swish around with some water if you're sitting there forever playing video games, and then don't sip on that Mountain Dew throughout that whole time you're playing those games. So that's really good educational information for parents to watch out for with their kids if they want to have smooth checkups.
Yeah, I wrote notes myself to look up Mountain Dew mouth later because I also really don't want to because it sounds terrifying, but
Well,
I'm so curious now. But what you said around switching out like with acidity for like parents and adults, is that the same type of thing way we should treat like drinking coffee? Because I think coffee is really acidic, isn't it too, right?
yeah, coffee is acidic. However, with coffee, I would say stains are more prone with coffee than cavities are. Coffee also tends to dry your mouth out a lot, so there's decrease in saliva production, and it can make your mouth feel very dry and sticky. And so the foods you eat after coffee will tend to clunk up and stick up because your saliva is very thick and it doesn't really move around much. So it's always a good idea to just throw in some water, swish around after coffee, and lubricate the mouth again. But most people don't consider this. I would say orange juice is a big component. Orange juice is very acidic, and some people will brush their teeth after drinking orange juice in the morning before they leave. But what that does is the acid in the orange juice will soften up your enamel. Then you go and put your toothbrush bristle on there. Now you're wearing away your enamel because it's soft. So I usually recommend waiting at least an hour after you drink orange juice to brush your teeth. You can brush your teeth before you drink orange juice. It might taste a little minty, but just plan on rinsing after you drink orange juice and wait at least an hour before you brush your teeth.
Yeah. I was a big orange juice kid, so I would always brush my teeth like an hour before I drink orange juice. Oh man. So Camilla just left a comment asking a very similar question, but for coffee. Should we brush our teeth before or after coffee?
I would brush your teeth before and after you drink coffee. Just swish around with some water. That way, what you're doing is when you brush your teeth before coffee is you're creating a nice smooth surface on your teeth, decreasing the chances of the coffee stains penetrating and sticking onto your teeth all day long. And so when you swish around with water, it should be easy to pop that stuff off.
Awesome. Also take note of that for my life. Um, so we talked about, or one thing we haven't talked about yet really is tooth sensitivity. What degree of tooth sensitivity should we be on the lookout, be on the lookout for versus what's we should expect? Because I think that there's a disconnect, at least in my life too, of if I were to eat this very cold thing, oh no, my teeth hurt. Is that because my like tooth sensitivity is increasing, or am I just not making smart choices?
Yeah, so tooth sensitivity can be very tricky because there are multiple avenues that can cause teeth to become sensitive. The best thing to do is to see your dentist first to rule out anything in terms of like a bacteria, cavity, or anything like that. I would say things to consider. If you have metal fillings, amalgam fillings, those guys have properties of metal, which basically are thermal conductors, so you can feel hot and cold with the metal very easily. So you might notice that if you're eating ice cream or drinking something really cold, those certain teeth might have little zings here and there that you might feel with cold sensitivity because the cold sensation is amplified from the metal filling. Another thing is you can have recession where you expose some portion of your root of the teeth, which makes it closer to the nerve, making those teeth much more sensitive. I always tell patients that the outer layer of the tooth, the enamel, is somewhat like a jacket. And once that jacket gets very thin, then all of a sudden you're going to start feeling a lot more cold. But if that jacket stays nice and thick and healthy, you're not going to feel much cold because that enamel is protecting that nerve. That's what it does. But as you get towards the bottom of the tooth, the enamel is very, very thick at the top, and then it starts to taper down towards the bottom, and then it's the root, and there's no enamel on the root. So that means there's no jacket there. It's basically running naked in Antarctica, and it's cold. So you have to have some type of protection there. In those cases, you might need to have something, a procedure done by like a periodontist, a bone and gum specialist, where they provide some type of coverage using your gums. It's a surgery that they do to bring your gums up to cover your roots, and that'll decrease the sensitivity. Yeah, teeth normally have little holes in them called dental tubules, and some people have a lot and they're larger, and some people have very minimal. And whitening can actually open up those tubules more and cause the teeth to become more sensitive. That's why there's toothpaste out there like Sensodyne. They have little molecules in there that go in and plug those holes so that you can decrease hot and cold sensations with teeth. The trick with using those type of toothpaste is the same thing. You floss, rinse, brush, spit it out. Don't rinse with water because you want that stuff to stay on your teeth or else it's not going to work.
Yeah, that's a great call out too. That toothpaste becomes inactive if you don't use the proper technique.
Definitely.
So how like you we talked a lot about flossing earlier. You know, you have to wash it or do it or else you're washing your butt but not the crack.
Yeah.
So if you are someone who neglected to wipe per se, how long until you start to see the positive benefits of flossing if you were to start picking that up into your daily routine?
I would say it would be for the patient to see it, not very, very soon. But I would say that for on our standpoint, it's almost immediately. As soon as you switch that habit, it's already a move in the positive direction, which basically helps over time. Because with teeth, it's not like the rest of the body. They don't tend to heal on their own. They need a little bit of help. And that help usually comes in the form of like fluoride to help remineralize it, or physical things like floss and toothbrush to remove things off of the teeth because the body naturally can't remove it itself inside the mouth. And so by you flossing, you're already helping. You're not doing anything bad. You're actually improving your chances of remineralizing and having your teeth stay nice and healthy and strong. So for me, in my perspective, I would say instantaneously. As soon as you switch up your habit and you're flossing on a daily routine, I'm going to start seeing the difference right then and there. For you, you might notice it maybe a year later when you have your x-rays done and your doctor compares your x-rays from the previous year and from the present day, and they can compare and see how large those cavities have become, or if they've kind of stayed the same. So that's how you can tell. It's usually by the next time you have x-rays done is when you can really tell. But they should feel a lot healthier. You should start seeing less bleeding of the gums when you start flossing.
Awesome. Yeah, and speaking of those like building of those habits, you have been again one of our biggest champions for helping us improve our product at AutoBrush.
It's a great
Um,
product.
we and it's because of your help, honestly. So how could a product like AutoBrush or just things in general help adults build those better brushing habits, in your opinion?
Um, with the AutoBrush, it throws in a lot of conveniency. I feel that the number one excuse that I hear from patients of all ages, even little 6, 7 year olds, is, "Oh, I just don't have time." I'm like, "Okay, you got a lot of things to do. Like, what you doing? Playing video games? What is it?" So, uh, AutoBrush just adds a conveniency to oral hygiene, which is a huge plus, especially for children, because that's the biggest hurdle is trying to get them to brush their teeth. They have other more important things to attend or to do, and that's where AutoBrush really comes in and just like helps out. And also, this is why I really love it for kids. Is I the AutoBrush has, it's been clinically proven to clean up the lingual surfaces of teeth 27 times better than a normal toothbrush, which is like amazing because that's the number one area that adults and children will miss when they're brushing their teeth. They don't angle that toothbrush back there to get those surfaces, which is equally as important as brushing the outside surfaces. So it has several advantages and it helps out tremendously.
Yeah, I mean, it's one of those random core memories I have from my child. But I remember going to the dentist and asking them if I was allowed to brush the inside of my teeth because they felt gross to me. And I just remember the dentist being like, "You're not brushing your teeth if you're not brushing the inside, child. Like, you're gonna give me a heart attack. Brush your teeth." So
Yes.
I feel that around like even the improvements as like an adult. I like that core memory of mine has made me so hyper aware of the inside lingual surfaces. Um, but in particular, just for like, I'll start with a little bit of my own testimony of like, um, I have ADHD. That's why I sometimes like need to reference my notes a lot. Like I don't have a great memory and like have poor like habit forming abilities. So having something that looks nice enough for me to like want to keep on my counter and I walk past every day, it does help me remember to brush my teeth. And 30 seconds, like you said, takes away some of those excuses. So while my like quote unquote disability, it's not really a disability, is very minor and doesn't really affect my day to day, how could a product like AutoBrush help those with other more like other disabilities that do really impact their brushing ability on a day to day basis?
Yeah, so for all the parents who have children with special needs, this is a great product. It's very, very challenging to brush with a very small toothbrush head, and you have to stand in front of the child and try to brush their teeth. It's not a very pleasant experience for the patient or for the child themselves. The auto brush just makes it really easy. It's very convenient. It's easy for the parents to operate, caregivers to operate. I feel like auto brush should be in every nursing home. It should be in hospitals for all those patients who are staying there for weeks and months, because I've had several patients who have had surgeries and whatnot and have been there for 3, 4, sometimes months, and they come back and their teeth are just shot. There's so much work to do. Well, guess what? They weren't brushing or flossing that whole time they were in the hospital, even though they were given a toothbrush, because it required them to get out of the bed, required them to use this little toothbrush. And I feel like the auto brush just makes it so much easier for nurses to be able to do that for the patients there. And a lot of the time, the medical field just doesn't really think about oral health when the patient is in there for any type of routine surgery or whatnot. And it's a huge component that I'm working on trying to bridge the gap and connect.
Yeah, sorry, I started to take notes too because I get weird, like a passion thing of mine is to just like is that I don't know equity in terms of you know like oral health is overall health, and now I have to go on a research binge to figure out why people don't brush their teeth in the hospital or aren't
Yeah,
given
check it
that
out.
like, making that a priority in their life. That's
Hospital and nursing homes, if you have parents who are in a nursing home, I would check up on them if they don't have even if they have dentures. I do a lot of training with nursing home staff and the nurses at the nursing homes to teach them about oral health and things to look for, just because all they know is a toothbrush and toothpaste, and if the patient will allow them to brush, they'll brush, but if not, they don't mess with it, they don't do anything with it. And so it's a huge problem, and it creates issues because these patients start suffering, and sometimes they can't speak or they can't express it, and so they'll lash out and start acting out with bad behavior because they're in so much pain, and it'll get to the point where it's really, really bad. Then they have to go to the emergency room, or they have to come see us on an emergency basis, where it just makes it a very unpleasant experience for them because they're in excruciating pain. And here we are sticking them with something sharp to help them get out of pain, but it's still very intimidating, and it's just overall not well.
yeah, especially considering how much like medical costs are in this country of just compiling on like hospital costs with additional dental costs. That's such a burden that I feel like should be so easily avoided. But speaking of, Jordan just left a comment saying that when she was in the hospital for emergency surgery, she had to ask for a toothbrush and toothpaste as she was flown 4 hours away from home and couldn't get her own.
It
Man,
happens all the time, but if you don't know, you don't know until you actually experience it. You know what I'm saying? Like if
yeah.
you experience, and Jordan, I'm sorry that you had to be flown out for that emergency surgery. Hopefully everything is well with you. But those are experiences that you don't really think about until you actually go through them. But these are things that I see in the clinic. I have a lot of emergency patients. I do a lot of emergency treatment here, surgeries, and that's one of the biggest things is they've been in a hospital or in a nursing home, and there's neglect where they're not being cared for oral health wise just because it's just not taught, and there's those consequences. So I think having AutoBrush available in hospitals is a big thing, and I've been actually trying to work on getting AutoBrush into some hospitals because I feel like it'd be a huge thing. But yeah, we'll see where it goes.
Uh, I'm sorry, I was just reading Jordan's comment. She said her
I
gallbladder.
read that too.
So,
Well, she said something about some gallbladder stones. Speaking of that, there are tonsil stones that you should also be looking out for. If you have bad breath and you are flossing and you are brushing and you're cleaning your tongue with the tongue scraper, because that's where 90% of the bad bacteria is that causes bad breath, is on your tongue. If you're doing all those things and you still feel like you have bad breath, check your tonsils. Just stand in front of a mirror, stick your tongue out, and say the word, and that'll cause your tongue to depress. And then you look back there at your tonsils, and you'll be able to see these yellow stones that are in like the grooves of your tonsils. Those things stink, and that can give you bad breath. And you can use a Q-tip or a water pick to kind of just push behind them, and those stones will pop out.
I that's going on to my list of conditions I should be aware of. Like my mind is blown. I didn't know that was possible.
Yes,
Man, now dental, you have kidney stones, gallbladder stones, and now tonsil stones.
man.
Man, our bodies need to stop producing stones. We're not made of rock.
For sure. 100%.
Uh, but okay, so as a dentist, how often should we like be expect to go into the dentist, I should say, for things like dental exams, cleanings, x-rays. I like just me personally, I thought it was like every 6 months. My mom's like, no, it's a year. And I did not know that as like an adult. Like I just assumed 6 months was a regular thing forever.
Yeah, so I mean, most insurances will cover if you're under 21, they will cover twice a year visit to cleanings. If you're an adult, typically it's one time a year that they'll cover and one cleaning. Now, certain patients are like higher risk, so patients who have dry mouth, I would like to see them at least twice a year because so many things can happen inside the mouth in those 6 months if we're waiting too long. And I'd rather catch something early than later. And so it all depends on your circumstances, your oral health, and how well you are doing brushing and flossing and maintaining your oral hygiene at home. But typically, once a year for adults, we do x rays once a year for adults and for children. And we basically just see how well you've been doing throughout that year. And we compare your old x ray with your new x ray and see if there's any new cavities that formed. If there are, that'll tell us, hey, we need to work on our flossing, or hey, these are the areas that you were missing with our brushing. Let's improve on that.
Jordan's daughter, Zerelda, said hi. So hello, Zerelda. I'm glad you're watching. I hope you're learning something awesome. So you did mention like cavities, like more filling, more of them forming and stuff like that. Are there cavities that don't get filled versus ones that do get filled? Because I've never really heard about just checking for a bunch of cavities like that and just the reaction being floss more rather than here, go, we need to go fill this right now, ASAP.
Yeah, so as dentists, when we look at x-rays, we look at how far the cavity has penetrated through the tooth. If it has gone all the way through the enamel layer, we have to put a filling in it. And the reason behind that is because the enamel is the hardest substance in the body. Once the bacteria has broken through that and it gets into the second layer of the tooth called the dentin, that is made up more of water. And so it's easier for the bacteria to just go right through that and get right to the nerve. And so we have to intervene, go in there, drill it out, and clean it up. If the cavity has not gone all the way through the enamel and it is very, very small, meaning we can see it on our x-ray and it hasn't gone past the line where the enamel and the dentin meet together, then we will say floss more. We'll use a fluoride toothpaste to help remineralize it and basically stop the bacteria from being able to have acid production that'll make that hole or that cavitation deeper and deeper to where it gets all the way through the enamel. So those are the ones that we will fill versus the ones that we don't fill. It all depends on your enamel.
Very interesting. So if it's not like, let's just say I had my dental checkup like 3 months ago, and I start to notice things with my teeth, what are those things that I should be on the lookout for and have that trigger of I should go back, even though it's not a year, I shouldn't wait another 9 months. Like I got to go see Dr. Gibbs now. What should I be on the lookout for in those, for that thoughts across my mind?
If you're eating, it mainly has to do with sweets, sweets or temperatures, like mainly cold. If you start noticing something new that just happened out of nowhere, and it's been persistent for weeks, like 2 or 3 weeks or something like that, it might be time to get checked out. I would say majority of the time I have a lot of patients that come in and they do something that I call it the olive pit syndrome. It's like when you're eating an olive, you forget there's a pit in there and you crunch down. You may not feel pain right then and there, but the next day you wake up and all of a sudden that tooth is very, very sore. You can barely touch it and it's really sensitive. It's very hyperactive, meaning anything hot, anything cold touches it, hurts. And that causes patients to come in for an emergency exam, which is good. You want to come in and have that done. Majority of the time, I literally just tell them to take ibuprofen to help with the inflammation and then to avoid any hard foods or really hot and cold temperature foods on that side. And the issue should subside within like the next 4 to 5 days.
Those were all of the set questions I have. So I want to make sure that the floor is open to everybody. If anyone else has any other questions, or if there's anything else you would like to talk about, the floor is absolutely yours.
Man, I mean, I can talk all day.
I was listening. This is a great conversation.
Okay, so for those that are just tuning in and missed out on the beginning section, get AutoBrush. Get it for your kids. Get it for your parents who have disabilities. It's amazing. It has been through clinical studies. There's science that backs it, and there are dentists who back it. The design is great. And the flavors of the toothpaste are really, really good. A little too good sometimes. I put a little bit on my cereal sometimes. I'm just joking. Don't do that.
What's your favorite flavor?
I have several of them that are on on my desk. I mean, I'm a classic mint. I love the mint, and I forget which other ones I have, but anything that I grab, I just like I put a little extra on there just because it's good.
I'm the same way.
But yeah, it's great stuff. We need to work on getting it into hospitals, into nursing homes, and spreading awareness of it because a lot of people don't know about it. I always just inform my patients like, "Hey, check out the AutoBrush for your kids," and they come back and they tell me, "Oh my gosh, I have to literally tell them to stop brushing." Before I used to tell them, "Hey, you need to start brushing," and now it's like, "Stop brushing because we got to go to school," or "Hey, we got to leave," and they're just running around, just moving out, dancing. My assistant actually showed me a video of her 5-year-old son standing there in his underwear, just going at it, dancing, singing along to the song. And before she struggled to get him to brush his teeth. And brushing is extremely important, especially with children as those teeth are developing. AutoBrush helps make it easier, makes parenting easier.
Oh, I just appreciate like all the things you've done with for our brand so much. I just can't help but smile, especially like hearing all the people we help. Like that's my favorite part of this job. Oh
That's the,
man.
that's the best thing. It's the reason why I decide to do what I do with AutoBrush is because it helps and it has the potential to help millions and millions of people. They just need to learn about it and understand how it works and why it works.
Yeah. Well, I want to make sure once again that we share your socials and your nonprofit. So that way anyone who's late to the game and maybe they haven't seen those links, they have access again because your work is honestly just as fabulous, if not more so, than what we do. Um,
Thank you.
and also for anyone who's stuck around this long, we do have a coupon code. If anyone wants to check out AutoBrush, the code is Gibbz15 after Dr. Gibbs and 15% off, which is beating our
Oh,
current back to school deal by 5% extra. So check that out. It's a great offer. And if there's no final questions, I really appreciate your time and all you've done for us, Dr. Gibbs.
no
It's
problem.
been
Thanks for
awesome
having
meeting
me.
you too. It's our first time
Yeah,
talking.
officially, it's always emails.
I know. I really appreciate it.
No
So
problem.
I hope your day and your week gets a little bit less busy soon. So
Well, we're
thank
almost
you.
nearing the weekend.
Yeah, we are. We're halfway through. So thank you everyone for joining, and I'll talk to y'all. I think our next live is next week's after Memorial Day, isn't it? Yeah. See you on the 1st, everybody.
All
Bye,
right.
guys.